affecting her health, or it's affecting the social norms, where I find that when a girl is pregnant, maybe due to certain circumstances, maybe she was raped, they wouldn't even disclose. They would rather get rid of that pregnancy in an unsafe manner. As a result, we have seen a lot of maternal deaths as a result of young people wanted to actually abort. We have seen where adolescents dumping babies after they have kept the pregnancy for 9 months because of society. I don't know how they manage even to keep the pregnancy, hiding it. Later on, we see this, we hear this on the media, they dump in the petrol trees. So when you have this information that you have this circumstance, can you follow this process and this procedure? Then they'll be helped. Then life should be actually saved. So there are many other causes that we can look to. I don't want to preempt what the organizers may have brought, but for us from YDF, we feel that I think the fear of parents need to actually start beginning engaging with their children. When they notice that the child is finding themselves in an awkward situation, let them educate, so that when they are aware of the information, they will definitely know how they're going to prevent themselves from getting pregnant and involving themselves in unwanted illegal abortions. Then also religious beliefs. When a child, an adolescent girl, is pregnant, maybe probably could be from the praise team, the whole church will actually disown that individual. So because of that self-stigma, a majority of them, you hear that charismatic committed suicide, they will lose out. So in Zambia, our health policy is that no one should die out of maternal. Actually, the people from the medics, they will explain further what the law provides in terms of maternal death. So that can be avoided. Then also, we realize that poverty is also another cause of this, because you find that somebody is poverty-stricken, is incapacitated poor, and these taxi drivers, they take advantage of these adolescent girls. They worship Kajo biscuit. The girl is taken. Then they go for policy implementation. As a result, the girl gets pregnant. Now for fear that now she's pregnant, to actually involve herself in unsafe abortions, which is not alright. I think I can cite as many as so as you speaking just as a remarks, we can even have 2 or 3 days just talk about how we can prevent this unsafe abortion. But on our remarks, we are actually thank the Zambia Association of Gynecologists and Obstetricians. You said it. Yeah. You should be open this way for organizing this event. This should not be one-off. We are hoping for more. Our Eastern Province has got so much rural places, and we believe that rural youths, rural adolescents, they should have this access to this information. So I'm sure the worship, the mayor, will actually highlight more where more space. Eastern Province is leading in terms of teenage pregnancy. In 2018, there was 27,731 pregnancies recorded from the health facilities. Now those are the recorded. What about the unrecorded ones? They just recorded the pregnancy. What about the abortion? So it means the number might be even triple of the recorded cases. So we're hoping that as we are beginning this process, let's journey together. I think on this few remarks again, I say thank you for giving us this.
My full names are Rasford Munga, District Education Standard Officer, standing in for the District Education Board Secretary, who is currently out on another assignment with Dr. Fanaka in Katete. Chipata District, we have on average a total of 70,000 learners from 136 schools. Of these 70,000 learners, 33,000 of them on average are boys and 37,000 are girls. So you can see that we have got more girls in schools than boys. In the first place, I'm happy and appreciate that a meeting of such nature has been organized, targeting the interest groups. As Ministry of Education, we are heavily affected you can agree with me that most of the unsafe abortions that have been talked about directly affect our ministry. In the sense that it has already been alluded that the age group between 10 and 20, they are the ones that are sexually active. And you are rest assured that these are school going. And if there is unsafe abortion that has happened among these adolescents in this age group, definitely as Ministry of Education, we are heavily affected. So, we do appreciate the line ministries that have come in, the different organizations that have come in to help us in this area. For sure, our aim as Ministry of Education is to ensure that we offer quality education, not only to the girls but to the boys as well. I'm sure you can agree with me that there is a myth, I wouldn't call it a myth, but a saying that when you educate a girl, you educate the family. Because there are so many benefits that actually come out as you educate a girl. Sorry. When we educate, it's not only for the purpose of getting a white-collar job, but there are so many benefits. You would agree with me that if the two girls, one is educated up to the level of grade 12, the other one only went up to grade 2, and all of them are living in a village, you would see that the mortality rate will be different. The one who reached up to grade 12 is likely to keep her children safer than the other one. Because if a child falls sick, the one who has gone to school will quickly rush to a health facility. Unlike the other one who would simply say, okay, let me go to a witch doctor. So, even in terms of nutrition value, the one who reached grade 12, the moment you wake up, will ensure that the child is fed, porridge, and so on. But the other one will simply say, okay, let me just look for chimba that remained yesterday. So there are so many benefits that we can talk about. Otherwise, as Minister of Education, we are more than glad and very happy that this has come at a time when we really needed this much information. And as a ministry, we are very much open. Our head teachers, our teachers are very eager to receiving this information so that together we can develop our country. And we can only develop our country if we educate the masses. With these few remarks, may I simply say thank you so much.
His Worship is Mayor of Chipata to address us.
District Education Board Secretary officers that are here, I recognize you. Representative from the YDF organizations and many other organizations that are here. Peer educators that are present here, I recognize you. The media, and may I simply say, ladies and gentlemen. Ladies and gentlemen, Zambia today, the 28th September 2021, joins the rest of the world in commemorating the International Day on Safe Abortions. Ladies and gentlemen, this day reminds us of the various precious lives that we've lost due to the use of various methods to terminate pregnancy. The use of sharp instruments, the use of traditional herbs, the use of undesirable concoctions has continued to terminate the lives of our women and adolescent girls. Ladies and gentlemen, it is from this background that the World Health Organization, WHO, has set this day to act as a reminder for the various stakeholders to be able to commemorate this day as a reminder of the most important action that needs to be taken to prevent and stop unsafe abortion. Ladies and gentlemen, the World Health Organization has set various guidelines to ensure access to safe abortion services are accessible to various stakeholders. And our government in 2012 participated in a meeting that was held in Nairobi, Kenya, and committed towards the support in terms of the implementation of a legal framework in this country that provides for termination of pregnancy in a safe manner following the prescribed guidelines. Ladies and gentlemen, there are various indicators that this government has supported. Among them includes increasing awareness amongst women, civil society organizations, and various stakeholders to be able to take on this issue of unsafe abortion. And another indicator has been to remove barriers in accessing safe abortion services. These are the two indicators that our government has increasingly been able to support and ensure that access to safe abortion is legal and supported by law. Ladies and gentlemen, as guests of honor, I would like to take this opportunity to recognize the Association of Gynecologists and Obstetricians for the efforts, for their immense effort and tireless commitment towards reducing unsafe abortions in our society. This issue of unsafe abortions, ladies and gentlemen, remain among the top 5 causes of maternal mortality death in our country. And it is currently estimated at 7% from 30% in 2017. Ladies and gentlemen, as government, we are aware of the project that ZAGO is implementing, which is called Prevention of Unsafe Abortion. As government, we recognize the strides that ZAGO continues to make that are aimed at complementing government efforts in reducing maternal mortality and save lives for our women and adolescent girls. And this project of preventing unsafe abortion by ZAGO is aimed at tackling the critical issues that surround this issue of unsafe abortion and recognize the effort by ZAGO as government. Ladies and gentlemen, it is also a fact that maternal mortality arising from unsafe abortion is still very high. And we know that as much as we have made progress towards the prevention of unsafe abortion through various interventions, we also know that we can't sit and fold our hands and say that all is well and we should stop advocating for safe abortion. We can't sit because we know that many of our people continue to die as a result of unsafe abortions. Many of our adolescents, many of our children continue to die. And we can't sit and fold our hands and say, oh, it's well. We can't do that. For example, ladies and gentlemen, Kitwe is amongst the districts with the highest rate of unsafe abortion, standing at 14% in terms of maternal mortality as a result of unsafe abortion. Kitwe tops the statistical chart with about 14%. Not only so, but also at our highest institution of health, that is the University Teaching Hospital, UTH in Lusaka, 30 to 50% of all the cases that are recorded in the gynecology emergency wards are as a result of unsafe abortions. And not only that, 15% of all deliveries that are made are as a result of safe abortion and safe abortion related complications. And this, ladies and gentlemen, is a matter of concern. And when you look at these statistics, you realize, ladies and gentlemen, that indeed we have a big role to play, for the problem that we have of unsafe abortion remains big and requires our concerted efforts as stakeholders to be able to address this big problem that we can't ignore or we can't forget. Ladies and gentlemen, Master of Ceremonies, the commemoration of this day, therefore, gives us a huge task to be able to galvanize our efforts and be able to think outside the box and confront this problem of unsafe abortion. More so in rural areas where this problem remains high and remains ravaging the lives of our adolescents and young women. Ladies and gentlemen, I would like to mention to you that Zambia in 1972 enacted an act of parliament on the prevention of, on the termination of pregnancy. And the particularly of interest is section 3A of this act, which states, and I quote, allow me to quote the part of this act on the termination of pregnancy, as it is stated that as it is clearly stated as a Termination of Pregnancy Act of 1972, section 3A of this act reads, and I quote, a person shall not be guilty of an offense under the law relating to abortion when the pregnancy is terminated by a registered medical practitioner if he and the two other registered medical practitioners, one of whom is specialized in the branch of medicine in which the patient is specifically required to be examined. End of quote. Ladies and gentlemen, there is an act of parliament that provides for a procedure on the termination of pregnancy when it is reasonably proven that such a pregnancy would be a danger to the survival of a child or a mother. And this is very important. And as the stakeholders in here, we should be able to draw our attention to this act and make sure that we sensitize our people about the legal framework that this country has provided, the law that this country has provided for safe termination of pregnancy. Ladies and gentlemen, the law clearly outlines conditions under which a person can terminate pregnancy. And it is therefore incumbent upon us all who are gathered here to sensitize the Zambian masses on the legal framework on abortions. Ladies and gentlemen, I'm also aware of ZAGO's work, that it is doing a lot of work in ensuring that sensitization of this subject reaches out to various stakeholders and groupings. Your trainings at ZAGO, to members of parliament, to our chiefs, to the media, to the young people and various stakeholders has yielded various results. Currently, as we speak, we've already seen the positive results that your trainings towards various leaders has started yielding due to the reduction in some of these unsafe abortions. But this is not to say that the problem has been completely tackled. we would like to bring you to the attention that your action to sensitize members and various stakeholders such as adolescents, youth organizations, the media, members of parliament and various stakeholders should continue across the country, and with a particular focus to rural districts which are most vulnerable in this unsafe abortion practice. The knowledge about the law, the knowledge about various issues and other factors that contribute to unsafe abortions remain very high and most common in rural areas. My district, for example, Chipata, is one of the districts that has been on the map in terms of high statistics, in terms of early pregnancies, teenage pregnancies, and various other aspects. And a composition of various reasons have actually contributed to a high level of unsafe abortions in a rural district like Chipata. And we therefore urge you to continue sensitizing various groupings, especially in rural areas, to be able to capacitate our adolescents, capacitate our stakeholders, our leaders, with the knowledge to prevent unsafe abortions. Ladies and gentlemen, as I conclude, I would like to urge all of us that are gathered in this room to be ambassadors of saving life through the promotion of safe abortions. Ladies and gentlemen, I would like to clearly mention that the Zambia Association of Gynecologists and Obstetricians, ZAGO, and other stakeholders are not in any way promoting abortions. What they have clearly stated and what they stand for is the prevention of unsafe abortion, which is very critical, because then it is one of the first 5 factors that are contributing to a high level of maternal mortality in our country. And obviously we've all lost our relatives, our young sisters, our mothers in maternal mortality. And if unsafe abortion is one of the 5 key factors that contributes to high level of maternal mortality, we should take interest in sensitizing our people on the prevention of unsafe abortion, on the prevention of use of various concoctions and other issues that promotes or that causes unsafe abortions in our society. Ladies and gentlemen, I would like to mention that our position is that we are not promoting abortion, we are standing against unsafe abortion. And that is our collective call as government and all stakeholders. And may I say that as we commemorate this day, we should go out and become ambassadors of change, ambassadors of information transformation, and ambassadors of conveying the message to the much needy societies that we come from, and to make sure that we are part and parcel of the change in the prevention of unsafe abortion. May I thank you, ladies and gentlemen, for your listening. May God bless our country, Zambia. Thank you.
The mayor, the officials, government officials present, the organizers, may I just simply say all protocol observed. My thanks to ZAGO for inviting me to speak as you bring this important discussion. I am pleased to note that this event will feed into most vulnerable girls, especially those in rural areas. Every year, many girls become pregnant, especially here. Last year, we have recorded the highest number, and this mostly happens without their intent to be pregnant. And of course, it leads to many unsafe abortions, especially that they don't intend to have to become pregnant, which puts many women at risk, especially girls at risk and serious complications and death. As the mayor had put it, that each one of us has to stand and be ambassadors of change. Most every death and injury, the results from a self-abortion could be prevented when we follow that process. And lastly, we recommend that the project enforce innovative approaches to ensure girls and women get the care they need during the pandemic by expanding self-care options backed with access to medical optimize in the face of the current challenge of COVID-19. We have realized that during the schools were closed and many incidences where a lot of girls felt pregnancy, and that led to many challenges where you know that you're pregnant and you just hear the opening of schools. What would you do? You opt not to let anybody know, instead discuss with your fellow peers, and the conclusion is that let's just go to somebody who knows it. And instead of going to a specialist, you opt to go to either the witch doctor, as it has been put, or maybe a person who's elder in the community to just help you, which is not safe. I think this information should be spread widely on the safety of abortion, because a lot have stigma and still fear going to the hospitals because they feel it is not right, or probably they'll be chased out, or probably they'll ask them a lot of questions why they have come and here and that. We have not learned a lot on the abortion, on self-abortions, especially that we have it in hospitals. I think this information has to be disseminated more so that young people could understand what it is when they speak of a self-abortion. Thank you.
The girl is taken. Then they go for policy implementation. As a result, the girl gets pregnant. Now for fear that now she's pregnant, to actually involve herself in self-abortions, which is not alright. I think I can cite as many as so as you speaking just the remarks, we can even have 2 or 3 days just talk about how we can prevent this and self-abortion. But on our remarks, we are actually thank the Zambia Association of Gynecologists and Obstetricians. You said it. Yeah. You should help me this way, for organizing this event. And this should not be one-off. We are hoping for more. Our Eastern Province has got so much rural places, and we believe that rural youths, rural adolescents, they should have this access to this information. So I'm sure the worship, the mayor, will actually highlight more where more states. Eastern Province is leading in terms of teenage pregnancy. In 2018, there was 27,731 pregnancies recorded from the health facilities. Now those are the recorded. What about the unrecorded ones? They just recorded the pregnancy. What about the abortion? So it means the number might be even triple of the recorded cases. So we're hoping that as we are beginning this process, let's journey together. I think on this few remarks again, I say thank you for giving us this.
What the new generation, there's nothing to keep them busy. And someone just mentioned the phones. It's like a new intervention now which can keep them busy. But we should first of all ask ourselves, what is the cause to this high rate of these pregnancies? When we find the cause to that, we put in the intervention to address that problem. Then maybe we'll reduce or end these pregnancies. Look at, we've got welfare halls. We used to use those in our generation because it's like children don't have anything to do, no recreation places where they can spend time. So the only recreation now will be sex. So partly you can't even blame them. I say you can't blame them. You have to look at the body the way it's made also, because the blame is going so much to adolescents. And you know what goes in the body of an adolescent. There are some hormones being produced. So let us look at the causes to these problems. If we address those causes, maybe even what we are commemorating today will also be reduced, if not brought to an end.
Yeah, she talked one of the causes.
Let us go back, because most times they say gender has been brought up from the Western countries, but I refuse to that. It's just the terminology we don't have in our African circles. Because if I'm to ask you that in my generation, if you are to make a visit to a village around 15 hours. Where am I going to find the women? They will be Kumutondo or Kumpero. That's where they were getting teachings. And where should I find men? It will be Kumpala. Where the rules to govern the village made from, it was Kumpala. So for anything to materialize, it was discussed at the Mpala and then told to the grown-up women to go and share with their fellow women. So anything good was constituted by men, and then they go and share. Not that these Arangizi come up with those activities, no. Anything to please them, they'll come up with that idea and then tell these big women to go and share with the women. So like preparation of how to please a man. Those are the negative traditional practices we are talking about.
Thank you. We follow the law. The law is very clear on that with regards to termination of pregnancy. So whatever we do is within the confines of the law. So the more we share knowledge, the more we even reduce unplanned pregnancies. Because people will be well informed and will be making decisions based on the information and knowledge they have. So this conversation is critical. Such issues are important.
Actually, talk about this vulnerability to be mostly from the negative cultural practices and beliefs, whereby a girl from a young age, and especially at the time that they come of age, they are taught a negative way of submission. I'll give an example of some culture which would say don't speak when somebody talks to you unless they give you money. That is immediately after the initiation of that girl. What do you expect that girl to do? She will grow up with that mentality to say, when somebody, that's when I can speak because now I'm a special being. And issues of Gwedu, where a fisi, where a girl becomes of age after the initiation ceremony, they are just grabbed and slept with by any man that so wishes. Apart from that, you realize that because our school curriculum does not have so much of the aspect of sexuality, comprehensive sexuality education, to do away with the negative cultural beliefs and practices, you find that the girls from a young age, they are not, they don't have the skills that they require actually to see them through in various situations. They don't have communication skills, whereby they are able even to have negotiation skills. For them to negotiate, as the young man said, to negotiate for safer sex. To say put on a condom. If you don't, then I think this game is over. It is because of the cultural upbringing that they have, that a man should have an upper hand, what the man says. Remember that some cultural beliefs would actually initiate a girl into how to handle a woman just after the initiation ceremony of becoming of age, not necessarily when getting into marriage. All those negative aspects, suppress the girl from being assertive. So because they are not so assertive, they will fall for anything. They will not have the decision-making skill. They will not have the problem-solving skill. They will rush for anything because they've shared to say, I'm pregnant, I don't know what to do, I don't want my parents to know, what do I do? They will confide in a friend. Regardless of what the friend will say, they will take that. To say, I know somebody who is, an expert in doing this. You just poke it out and, it will come out. So, all those are actually based on the fact that as a country, we do not have a strong, comprehensive sexuality education program in place.
We are humbled for that, and the level of encouragement to ensure that this message reaches all the corners of our country is very humble. Thank you so much, Debs, the health officials,
people from Ministry of Traditional Chiefs Affairs. We are grateful for coming with us and commemorating this very important day with us. Much has been said, but more has to be done. We have a huge task, if I'm to borrow the words of the worship, his worship, the mayor. We have a huge, a mammoth task ahead of us to save life. We cannot afford, indeed, your worship, as you clearly put it, to fold our hands and leave our people, our young girls, die from complications of unsafe abortion. We can't. Life is too precious. No life should be lost as a result of unsafe abortion. And that's the major message, even us as Zambia, we share with the rest of the people in this country. No woman should die from unsafe abortion. It's something that is preventable. We can prevent it, and we have to prevent it. A woman's life is so precious. A girl's life is so precious. Knowledge is power. He who has knowledge has the power and can define and design the path of their lives. And this is critical to us as an association. We need to share this information, we need to share this knowledge, we need to provide this awareness, and we'll continue to do so. Your worship will come to you for a program here in Chipata. I think in the next couple of weeks or so, months, definitely we'll reach out to you so that you can allow us to meet the various stakeholders in this town and share the information. Our aim is to save lives.